Nice lunch, bless you. So we're going to look at the development of the choroidal system, the choroidal vessels, and the various territories that go with the evolution of these vessels. So we're going to emphasize the relationship between the antecerebral, the antichoroidal, and the posterior cerebral system. There are phylogenetically and embryological evolutive relationships between the antecerebral, the antichoroidal, and the posterior arterial systems. Initially, there's a balance between the antecerebral and the antichoroidal artery. They are the main vessels because they are the original vessels supplying the choroidal systems, and they create an early limbic ring. Then there is the antichoroidal artery territory is slowly transferred to the posterior artery, and that creates a late limbic ring. So just keep that in mind, that's what we're going to look at. Just very quickly, some embryology. The third week, the placard develops. The fourth week, this develops rolling into a tube. Then after that, the distal and proximal end of these tubes will close at the level of the neural pores. And then at the 23rd day, the lamina terminalis and the anterior cephalic aspect of the third ventricle will close. The anterior thing closes and the posterior aspect, the lower part. And then at the fifth week, these vesicles develop, the prosencephalon, the forebrain, the mesencephalon, midbrain, and normencephalon, the hindbrain. And they are covered with dense, primitive, connective tissue called the meninx primitiva. So the neural tube and the vesicles are being covered with a soft tissue, connective tissue called the meninx primitiva. And then further from the initial three, the two lateral ventricle telencephalic vesicles grow out on both sides in preparation for the development of the brain, the adult configuration. The meninx primitiva contains angioblasts, and as Timo already told you, they are the precursors of the endothelial cells. They assemble in angioblastic cords that form a plexiform vascular network around the neural tube. During the fifth week, this perineural vascular network connects with the general vascular system, so the system that is described to you, and this one become connected. And then further changes occur within the meninx primitiva. The superficial layer organizes into an arterial and venous channels, and some of the venous channels will form primary sinuses located on each side of the neural tube. And the deep layer, closest to the neural tube, organizes into a capillary network. So a capillary network close to the neural tube and covered by a superficial layer that contains the ventral arteries and veins. And connections will form between these two layers. So the five vesicles at that point in time, you have the telencephalon, diencephalon, and myelencephalon. The meninx primitiva now penetrates towards the ventricular ependyma and will form the choroid plexus. At the diencephalic telencephalic junction, this is to form the choroid plexus of the lateral ventricles. At the roof of the diencephalic vesicle, it forms the choroid plexus of the third ventricle, and at the level of the myelencephalon, it forms the choroid plexus of the fourth ventricle. And as you remember, the brain at that point in time is very early in its development, so the main arterial and venous drainage systems are related to the development of the choroid plexus that will eventually form the basis for all the other vessels. So an arterial limbic ring will be developed from two sources. The anterior portion of the choroidal ring is constituted by the future anterocerebral artery. It develops around the neck of the telencephalous vesicles, and the anterocerebral artery is at this time a choroidal artery. So there's not much brain there, it's a choroidal vessel, the anterocerebral. The posterior portion of this ring is formed by the anterochoroidal artery. Together they form the initial supply to the choroid plexus. So these are the two main vessels supplying the choroid plexus, the anterocerebral and the anterochoroidal. The telencephalic vesicles are at that stage supplied by the anterocerebral and the anterochoroidal arteries, both arising from a cranial division of the internal carotid artery. Remember? The choroidal arteries are the first arteries to appear and constitute the basic system upon which the distal branches, the future arterial tree towards the brain, will be grafted. So the anterior portion of the ring, as I mentioned, is from the anterocerebral artery. So remember, the anterocerebral artery at that point in time goes around the telencephalic vesicle and hooks up at the lower level with the anterochoroidal artery. Yeah, so these the anterior branch of the carotid system, the posterior branch going to the upper basilar. The anterior branch represents the anterocerebral and the anterochoroidal, and the middle cerebral artery at that point in time is rudimentary. It's not very well developed at all because there's no brain to go to. And this occurs, this is not new, this is well known in some of the animal kingdom vessels, and this is published also that you have the same in the opossum, where you have this arterial arcade between the anterochoroidal and the anterocerebral arteries, forming a ring around the vesicle. And in these can in some people persist, this limbic ring, this early configuration, this is the posterior, this is the posterior communicating artery, this is the anterochoroidal. You can see the anterochoroidal is still visible all the way around, and eventually would hook up to the anterocerebral artery to form this limbic ring. Subsequently to the paired ventral longitudinal axis fusing in the midline to form the basal artery, the process starts at the trigeminal artery. You know that very well, we discussed that. So there's an independent evolution of the posterior branch, but the anterior branch, it's the evolution towards the choroidal, towards the limbic ring, from the anterochoroidal and the anterocerebral arterial systems. Now the posterior cerebral artery, which supplies the upper basilar territory, has some very small branches to the mesencephalon and the diencephalon, but basically nothing else. So as the brain is still developing, these are the only small vessels that come off the posterior cerebral arterial system. But the anterochoroidal artery and the anterocerebral arteries are strongly developing because of the need to supply the choroidal system. So you can see in green is the anterochoroidal, in blue is the posterior cerebral. You can see the posterior cerebral artery at this point in time does nothing to the choroidal system, but the anterochoroidal artery actually forms the ring that goes all the way to the foramen of Monroe and then into the choroidal branch of the anterocerebral artery and goes all the way back again. Now, even although the main system is designated to create the choroidal vascular tree, there is some early evidence of small branches both from the anterocerebral artery as well as from the anterochoroidal artery to go to the developing brain. So at the end of this choroidal stage, the anterior division of the internal carotid artery forms an arterial ring, which is first meningeal and then becomes choroidal. The posterior division of the internal carotid artery sends branches to the diencephalon and mesencephalon, but doesn't do very much to the brain yet. And the primitive territory of the internal carotid artery extends therefore down towards the upper basal artery from the posterior communicating P1 system as we described, but it does very little in the way of participating in the supply towards the brain at that point in time. So again, in green, the anterocoroidal system. The anterocoroidal system that participates in the supply to the choroidal vasculature and is in balance with the anterocerebral artery. And then from the posterior artery in blue, in addition to the few branches that I described before, to the mesencephalon and diencephalon, is creating an anastomotic channel with the choroidal system. So this is the future posterior choroidal system that is hooking up to the anterocoroidal artery. The anterocoroidal artery is also starting to develop the telencephalic branches. Here you can see as the brain develops, the supply to the brain is coming from the anterocoroidal artery system. And as this further develops, you will see the posterior cerebral arterial system is not only hooking up to the choroidal system of the anterocoroidal artery, it's also starting to form anastomoses to the vessels that supply the evolution of the brain. So you can see that initially these communications were very small, and the main supply from the posterior cerebral P1 segment is towards the mesencephalon, mesencephalon. But in time, these anastomoses between the posterior cerebral artery and the anterocoroidal artery system developed towards not only participation in the supply towards the choroidal system, but also in anastomotic channels towards the branches that represent the supply towards the brain, towards the telencephalon. And so we can see that eventually this becomes quite well developed, and you can see that these the anastomotic channels between the posterior cerebral and the anterocoroidal system become very well developed, and there is an atrophic regression of the size of the telencephalic branches of the anterocoroidal arterial system. So at the end, towards the evolution and the adult pattern, you can see that the anterocoroidal artery has regressed. It doesn't mean it's a small vessel, it's not important, and you will see from Alan Taylor and from Philippe that it's a very important vessel, especially proximally, but distally it's regressing, and its territory towards the brain is taken over completely by these anastomotic channels that go to the telencephalic branches of what originally was the anterocoroidal system, but now becomes part of the posterior cerebral arterial system. So there is an evolution towards shifting the territory from the anterocoroidal towards the posterior cerebral artery. And eventually this is the configuration that you're obviously very familiar with. So we have now the telencephalic branches towards the temporal lobe and the calcarine and the parietal lobe are now taken over completely by the posterior cerebral arterial system, and the anterocoroidal has become. There's some early anastomotic channels around and we'll get into that with Philippe and Zel. But most of it is now just directed towards the choroidal arterial system. So again, two types of limbic circles. The early one is the anterocoroidal artery communication with the distal anterocerebral artery, and we show this, and the later one linking the posterior cerebral artery and the anterocerebral artery once the posterior cerebral artery has taken over its territory. So you can see now the posterior cerebral artery is communicating with the anterocerebral distal branches. The later configuration may persist in patients with vein of Galen malformations. So you can see the early arterial supply, and you can see the supply deep to the foramen of Monroe level with the posterior choroidal system, and you see the telencephalic anencephalic branches that communicate now just beyond the corpus callosum towards the antecellular arterial system. So the postecellular artery ring towards the antecellular artery that has evolved. Now so obviously, as similar to what we've discussed earlier today and yesterday, this evolution can be complete and full, or it can be incomplete and partial, or it can be not at all. So in this case, when we look at an angiogram on the patient, internal carotid angiogram and the vertebral basal injection, you see on the vertebral injection, there is no blood going this way. And if you look at this thing, you see the anti-choroidal arterial system has a lot of vessels coming off. So in this case, the temporal territory is persistently opacified by the anti-choroidal. The temporal territory is not supplied by the postecellular, but continues to be supplied by the anti-choroidal arterial system. So this is one variation that can occur that may surprise you. In this case, you see on the vertebral basal injection, you see there is no vessels shown in this location. And then when you look carefully at the carotid angiogram, you see that the anti-choroidal artery has a large amount of vessels where it's going to. So there's persistence of the parietal occipital territory from the anti-choroidal artery. So again, you can see partial persistence or full persistence of the lack of evolution towards a complete turnover from the anti-choroidal to the postecellular. You may have variations, and you will see more of them as on the table. In the normal situation, of course, is shown here, where the anti-choroidal is in quite a small vessel, and the postecellular artery has taken over the occipital, parietal, and temporal territories, as you can see here, all three. So the anti-choroidal posterior cerebral arterial system summary. The phylogenetic termination of the internal carotid artery is at the level of the future picon. Remember, we discussed it multiple times, phylogenetic. Speaking, the postecellular artery supplies the upper basilar territory. That's the original regional supply coming from. The internal carotid artery distal to the picon is the anterior division of the internal carotid artery. Its initial two main branches of this anterior division is the internal of the internal carotid artery are the anterior cerebral and anterior choroidal arteries. The middle cerebral artery is phylogenetically speaking a branch of the anterior cerebral artery. We tend to think that it's the other way around, but in reality, it's the middle cerebral is a branch of the anterior cerebral artery. The anterior artery is an old artery, originally anastomosis with the anterocerebral arterial system to form an early limbic ring and vascularizes the extensive cortical territory. Subsequently, it transferred its cortical territory partially or completely to the postecellular artery. We've seen examples of that. The postecellular artery forms from the posterior division of the internal carotid artery. It supplies initially only the tectum, but will become the classic postecellular artery after having taken over the cortical territories from the anterior choroidal arterial system. So it's an evolution based on anastomosis, captures, regressions, and changes in flow directions that will eventually create, in most people, the majority of us, and the usual final arrangement known in adults. But incomplete maturation may create predictable variations. Thank you.